Just like treatment, staging, categorizing myeloma patients at the time of diagnosis, do they have low disease burden or high disease burden? So we had Jury-Salmon staging system before, then we came to revised ISS stage system, and now this is the second iteration of the international staging system, or R2-ISS. So again, it takes into consideration beta-2 microglobulin, albumin, LDH, and 3 chromosomal abnormalities, translocation 414, deletion 17p, and the gain or amplification of the long arm of chromosome 1. So incorporating that into a newer staging system, or R2-ISS, which stratifies patients from stages 1 to 4. And generally, what you expect that patients with stage 4 would have higher disease burden and worse outcome. So this was reported, and we just wanted to see how did our patients do when we looked at their staging through this R2-ISS stage. So again, from our database, we found about 1,300 patients for whom we had all the variables that are used to stage R2-ISS staging system were available. And then about 10% of those had stage 1 and 10% had stage 4 disease. 80% were stage 2 or 3. And then again, as we discussed, that most of these patients received proteasome inhibitor and immunomodulatory drugs. They all received autologous stem cell transplant. And what we saw was that, yes, patients who had early stage disease had significantly better progression-free survival, as high as 6 years in those who had stage 1 disease to about 2 years in those who had stage 4 disease. And similarly, overall survival, which was 11 years or longer in those who had stage 1 disease to about 5 years. So again, we are shown that this R2-ISS staging system is applicable to all transplant patients, and it can stratify patients into different risk groups, and the highest risk patients do worse and the lower risk patients do better, again challenging us to find better treatment for these patients. So this basically validates or confirms what has already been reported, and there are other centers and other places that are looking at this R2-ISS staging system in their patient population as well.